Nail fungus, also known as onychomycosis, is a common condition affecting millions worldwide. It occurs when tiny microscopic organisms called fungi infect the nails. These fungi thrive in warm, moist environments, making our feet particularly susceptible. While nail fungus rarely poses serious health risks, it can cause discomfort, embarrassment, and affect our quality of life. Nail fungus often begins subtly, with barely noticeable changes in the nail's appearance. As the infection progresses, it can lead to discoloration, thickening, and even crumbling of the nail. While toenails are more commonly affected, fingernails can also fall prey to this stubborn infection. Understanding the nature of nail fungus is crucial for effective prevention and treatment. Recognizing the early signs and seeking timely intervention can make a significant difference in managing this prevalent condition. Nail fungus is not merely a cosmetic concern, it's a sign of an underlying infection that requires attention. By understanding the causes, symptoms, and treatment options, we can take proactive steps to maintain healthy, beautiful nails. Nail fungus often begins subtly, with subtle changes in the nail's color and texture. Early detection is key to preventing further spread and complications. Here are some telltale signs to watch out for. Discoloration. One of the first noticeable signs is a change in nail color. The nails may turn white, yellow, brown, or even black as the infection takes hold. This discoloration usually starts at the edge of the nail and gradually spreads inward. Thickening. As the infection progresses, the nails may become thicker and more difficult to trim. This thickening occurs due to the accumulation of fungal debris beneath the nail plate. Brittleness. Infected nails often become brittle and prone to crumbling or breaking easily. This fragility can make everyday activities like walking or wearing shoes uncomfortable. Distortion. The shape of the infected nail may become distorted, appearing uneven or ridged. In severe cases, the nail may even detach from the nail bed, causing pain and discomfort. If you notice any of these symptoms, it's essential to consult a healthcare professional for proper diagnosis and treatment. Early intervention can prevent further complications and help restore your nails to their healthy state. Nail fungus isn't caused by a single factor, but rather a combination of elements that create a favorable environment for fungal growth. Understanding these causes is crucial for effective prevention. Moist environments. Fungi thrive in warm, moist environments. Shared showers, locker rooms, and swimming pools are breeding grounds for these microorganisms. Wearing sweaty shoes or socks for prolonged periods can also increase your risk. Weakened immune system. A compromised immune system makes you more susceptible to infections, including nail fungus. Certain medical conditions and medications can weaken the body's natural defenses. Nail trauma. Any injury to the nail, no matter how small, can create an entry point for fungi. Activities that put repeated pressure on the nails, such as running or tight footwear, can increase the risk of infection. Age. As we age, our risk of developing nail fungus increases. This is partly due to reduced blood flow to the extremities, making it harder for the body to fight off infections. By understanding the factors that contribute to nail fungus, we can take proactive steps to minimize our risk and maintain healthy nails. Simple measures like keeping feet clean and dry, wearing breathable footwear, and practicing good hygiene can make a significant difference. While home remedies might not completely eradicate a nail fungus infection, they can often help manage symptoms and prevent further spread. These natural approaches are generally safe and readily available. Tea tree oil. This essential oil possesses potent antifungal properties. Applying a few drops of tea tree oil directly to the affected nail twice daily can help inhibit fungal growth. Apple cider vinegar. The acidic nature of apple cider vinegar creates an inhospitable environment for fungi. Soaking the affected foot in a solution of equal parts water and apple cider vinegar for 15 to 20 minutes daily can be beneficial. Coconut oil. Coconut oil contains lauric acid, a fatty acid with antifungal properties. Massaging a small amount of coconut oil onto the affected nail and surrounding skin twice daily can help moisturize and combat the infection. It's important to note that home remedies may take several weeks or even months to show noticeable results. Consistency is key when using these natural approaches. If you don't see any improvement or if your symptoms worsen, consult a healthcare professional. Section 5. Over-the-counter solutions, accessible relief. For mild cases of nail fungus, over-the-counter antifungal treatments can provide relief and promote healing. These readily available options come in various forms including creams, ointments, and solutions. clotrimazole and maconazole. These antifungal agents are available in creams, ointments, and solutions. Apply the medication to the affected nail and surrounding skin as directed on the packaging. Tolnaftate. Tolnaftate is another effective antifungal agent found in over-the-counter creams and powders. It helps inhibit fungal growth and relieve itching and irritation. Undesolenic acid. This antifungal ingredient is often found in over-the-counter foot powders and sprays. It helps create a hostile environment for fungi, preventing their growth. While over-the-counter treatments can be effective for mild cases, it's essential to follow the instructions carefully and use the product consistently. If your symptoms don't improve within a few weeks, or if you experience any adverse reactions, consult a healthcare professional. Section 6. Prescription medications, targeting stubborn infections. For moderate to severe cases of nail fungus, prescription-strength antifungal medications may be necessary. These medications are typically more potent than over-the-counter options and target the underlying infection more effectively. Oral antifungal drugs, such as terbinafine, Lamisil, and itraconazole, Sporanox, work by preventing the growth of fungi. They are typically taken for several weeks or months, and complete nail regrowth is necessary to see the full effects. Prescription-strength topical solutions, such as efinaconazole, Jublia, and tavaborole, Keratin, can be effective for mild to moderate infections. These medications are applied directly to the affected nail and surrounding skin. Medicated nail lacquer like cyclopyrox Penlac is applied daily to the infected nail and surrounding skin. It requires consistent application for several months to be effective. It's crucial to follow your healthcare provider's instructions carefully when using prescription antifungal medications. These medications may have potential side effects, and it's essential to report any adverse reactions immediately. Section 7. Advanced treatment options, when other methods fall short. In some cases, traditional treatments for nail fungus may not be sufficient, or the infection may be particularly stubborn. In such instances, advanced treatment options may be considered. Laser therapy uses focused light beams to target and destroy the fungus within the nail without damaging the surrounding tissue. Multiple sessions are usually required for optimal results. Photodynamic therapy involves applying a photosensitizing agent to the infected nail, followed by exposure to a special light source. The light activates the agent, destroying the fungus. In severe cases, surgical or chemical removal of the infected nail may be necessary. This allows for the new, healthy nail to grow in without obstruction from the infected tissue. These advanced treatment options are typically reserved for cases that haven't responded to other methods. Your healthcare provider will assess your individual needs and recommend the most appropriate course of action. Section 8. Preventing nail fungus. A proactive approach. Prevention is always better than cure, especially when it comes to nail fungus. By adopting simple yet effective preventive measures, you can significantly reduce your risk of developing this stubborn infection. Wash your feet daily with soap and water, paying particular attention to the areas between the toes. Dry your feet thoroughly, especially after showering or swimming. Choose shoes made of breathable materials like leather or canvas. Avoid wearing tight-fitting shoes or shoes that make your feet sweat excessively. Opt for socks made of moisture-wicking materials like wool or synthetic blends. These socks help keep your feet dry by drawing moisture away from the skin. Wear shower shoes or sandals in public areas like locker rooms, swimming pools, and communal showers. This prevents direct contact with potentially contaminated surfaces. Trim your toenails straight across and avoid cutting them too short. Ingrown toenails can create an entry point for fungi. Regularly clean and disinfect your nail clippers, files, and other tools to prevent the spread of infection. By incorporating these preventive measures into your daily routine, you can significantly reduce your risk of developing nail fungus and maintain healthy, beautiful nails. Section 9. Seeking professional guidance, when to see a doctor. While home remedies and over-the-counter treatments can be helpful for mild cases of nail fungus, it's essential to seek professional guidance if your symptoms don't improve after a few weeks of home treatment or if they worsen. If you have diabetes, a weakened immune system, or other underlying health conditions, it's crucial to seek medical attention for nail fungus. If you experience significant pain, discomfort, or swelling around the affected nail, consult a doctor promptly. If you're pregnant or breastfeeding, it's essential to consult your healthcare provider before using any antifungal medications, including over-the-counter options. A healthcare professional can accurately diagnose the infection, determine the underlying cause, and recommend the most appropriate treatment plan for your individual needs.